Welcome to LinguaWire English A1. Today we have two stories: a new study in Oregon and a cancer vaccine test. To help you follow today, transcripts and vocabulary lookups are at linguawire.com. Our first story is about a study in Oregon. Now we go to Ella, our LinguaWire correspondent for health.
Thanks, Daniel. In Oregon, a new study looks at people who took psilocybin. Psilocybin is the drug in magic mushrooms.
And this was not a small test, right?
No, it was quite large. The study looked at almost 350 people. They took the drug at state-licensed centers.
So this was real life, not a lab room. What did the study find?
Most people said the trip helped them. More than half said it was very meaningful. They said it was one of the most meaningful experiences in their lives. The study also says the program seemed safe overall.
So the picture is mostly positive. Were there any serious problems?
A few, yes. Only a very small number had serious bad reactions. One person went to the hospital after a violent reaction. Another person later went to the emergency room because of anxiety.
That sounds worrying, even if the number is small. Who was using the drug?
The people had different reasons. Some were curious. Some wanted self-improvement. Others wanted help with mental health or trauma.
So this was not one single kind of patient. What do the researchers say about the people in the study?
The study group was only a small part. It was part of the bigger program. The program has had more than 20,000 people. That was since it started about 3 years ago. Many people in the study were white and college-educated. About a third had a household income over $200,000.
So the group was not very mixed. Did the researchers say the drug was safe for everyone?
No, not for everyone. One expert said the study is too small. He said some people have had hard times after their experience. So the news is hopeful but careful.
Our second story is about a cancer vaccine test. Now we go to Noah, our LinguaWire correspondent for health.
Thanks, Daniel. Moderna and Merck say their mRNA cancer vaccine worked. It worked in a late-stage trial for melanoma.
That is a big claim. What kind of trial was it?
It was a phase 3 trial. That means a late test with many patients. There were 137 people in the study.
And what kind of cancer did they have?
They had melanoma. It is a serious skin cancer. Their cancer had been removed before the trial started. Then the trial checked if the cancer came back.
So the key question was return, not just treatment. How did they split the patients?
2 groups got different care. One group got the vaccine with Keytruda. The other group got Keytruda alone. The trial was also double-blind. That means the doctors and the patients did not know who got which treatment.
That helps keep the test fair. What did the companies say the vaccine did?
They said it helped people stay free from the cancer. They said it helped for longer. They also said it helped people stay free from cancer in other parts of the body. They called the results important and meaningful.
Do we know all the numbers yet? Or are we still waiting for more data?
We are still waiting for more details. The companies say the data will be shown at a medical conference. They also pointed to earlier results from a 5-year study. That earlier study showed less risk of the cancer coming back. It also showed less risk of death.
So this is promising, but not the final word. What makes this vaccine different?
It is made for one patient at a time. It looks at a patient's cancer cells. Then it picks the cancer changes. That can help the immune system see the cancer. That is why people are watching it closely.
Three words from the first story. Study means a careful look at facts. In the story, the study was in Oregon. Example, we read a study about sleep. Center means a place for a service or activity. In the story, people took the drug at state licensed centers. Example, she goes to a health center. Reaction means what your body does. In the story, one person had a violent reaction. Example, he had a bad reaction to the food. Now the grammar point, was and were. We use was and were to talk about the past. The study was quite large. They were not in a lab room. Repeat after me, was quite large. New this month, the LinguaWire Field Guide. For every news theme, it gives you the 50 key words to know, the most important verbs and conjugations that cover 90% of the full month's news podcast episodes, and lesson sheets on the fundamentals, how sentences are built, how the articles work, with flashcard practice to test yourself on all of it. Find it at linguawire.com guide.